Face the Future Foundation has now been in existence for 27 years, and this is our 54th mission altogether, our 4th mission to Nepal. Our goal really is to find out what the local surgeons, what the local healthcare teams need, and then we try to provide those services. We're also dealing with patients who have complex head and neck and other body injuries that would not be otherwise treated. The most significant injuries we see here are burn injuries. And unfortunately here, when one sees patients that come in 2 and 3 days sometimes after their injury, their resuscitation has been much delayed.
So a lot of the burns were very high percentage, about 30 to 50% burns in all ages, from infants to the elderly. Mortality was a lot higher. We had a pediatric patient who passed away, so a lot of very extensive, very serious burn injuries. I had the opportunity to do dressing changes with some of the nurses, and we had some time to sit down and talk about different wound care, different burn depth, and different forms of treatment for each of those.
Well, wounds can get infected. Right? Your skin is your #1 barrier against infection.
When we came to Nepal in 2019 and met with Dr. Rai and Dr. Nakarmi, we asked them, what can we help you with that you're not already getting? The number of cases and the number of surgeries is really quite varied across the board, but tend to be more complicated head and neck, craniofacial types of surgeries.
We're treating patients with severe nasal issues, with reconstruction, sometimes utilizing ribs. Some of these injuries are from trauma, some of them from burns, some of them congenital. We're also dealing with serious hand injuries. We have a physiotherapist who is very active and very helpful in training our Nepalese colleagues in some of the more advanced ways of physiotherapy rehabilitation.
It's more important that he gets early motion and starts so he doesn't get stuck. So you want to
Face the Future particularly, their goal is to teach themselves out of a job on all of their missions. Our goal is really for them to teach the teams here how to be sustainable. The educational aspect from a didactic standpoint is quite strong, and then that teaching continues on into the operating room or into the ICU or the surgical units throughout the day.
Nursing was an area that really needed more work. So every day we've been doing lectures with the nurses, and we were really surprised with 25 to 30 nurses showing up, and even though they're all in various areas, everybody has some takeaways from that piece of it too.
Your back has really thick skin.
You know, it feels like this year, after our 3rd year, we really have truly formed deep relationships with people, and I think that the foundation that we've laid with the relationships is going to really provide a great framework and structure for us to just create great care at this hospital and great care for the patients.
Looks amazing, Bruce. Amazing. One operation and he's almost back to normal. He's got to heal, but wow.
Yes.
As we say with Face the Future, our tagline is we provide hope, and we indeed transform lives, the lives of our patients, and we look to transform the lives of the healthcare providers in these countries so that they can feel empowered to make a difference in their own countries.